webinars, and I'd like to introduce our next speaker, Kelly Altum, CEO of Medanext Inc. And following the presentations, Mr. Altum will take questions across the hall in room 611.
Good afternoon. My name is Kelly Altum, and last year we attended this event in the speed dating. And I'm really happy to be here 1 year later to talk with you about Medanext. Our office is in Redmond, Washington. And one day our neighbor in the building stopped into the office and said, "So what do you guys do?" So I pulled out our tablet, and it's an Android tablet, and showed him a prototype of our application. And he said, "You know, it's about freaking time somebody did that." And that's a sentiment we hear a lot, and I hope you feel the same way after we're done. So Medanext is focused on helping hospitals and patients manage the transition from home to hospital and hospital to home. We're developing 3 products, and these products are designed to improve outcomes and lower costs. To achieve our goals, we are here to raise some money. We have some angel investment already, and we're using that money to finish the development of our product, and we are going to pilot our product at Providence Regional Medical Center in Everett. And if you're not familiar with Providence, they are the 10th largest hospital system in America. So the opportunity, the problem we're trying to solve is around hospital readmissions, patient non-adherence, and the costs that are associated with that with Medicare. So patient non-adherence in particular, this is a recent study from Vanderbilt University that has half of heart patients within a critical 30-day period after they leave the hospital make a mistake with their drugs. And a quarter of that 50% are serious life-threatening mistakes. So as you can see, it is a critical problem that needs to be solved. Now, because the Supreme Court has finally approved the Accountable Care Act, Medicare and Medicaid in FY13, which starts in October, will begin the ability to fine hospitals who have excessive readmissions. That fine is significant. The first year it's 1% of their total Medicare payments, 2% in the next year, 3% in the following year. Now they also have the ability to refuse to pay for the readmission. And we've talked to a lot of hospitals and a lot of insurance companies, and they all plan that insurance companies, private insurance companies, will follow the lead of Medicare and stop paying for readmissions. So what we're creating is a cloud-based system, and we're trying to close the loop between primary care, the home, the hospital, and the specialist. This is a transitional service, and what I mean by transition is to help the patient and the hospital manage the transition when a patient goes from primary care, then they go to the hospital, to the specialist, then they go back home again. We're the only service out there that will tie those 3 groups together into one service. And we're using mobile technology on cell phones, on tablets, and I'm going to show you the tablet application prototype we have, and through the web through a traditional PC. So Medasync is the name of the product that at the core of the Medasync product is a health path. A health path is a roadmap for the patient to follow. A health path is created using our service by a type of a new role inside of a hospital, which is an adherence coach. And the adherence coach configures a health path based on the prescription that is given to them by the physician. So a physician prescribes the health path, an adherence coach configures the health path for that particular patient. Now, virtually everyone we have talked to has some story to tell us about their experience in a hospital. Now, one of the team members that we have is his wife is pregnant, and she has a form of diabetes that is associated with her pregnancy. And he's working on the Health Path product right now. Every day he thinks to himself, why don't I have this right now to help my wife manage her pregnancy and her diabetes at the same time? Because the number of tasks she has to complete every day is quite a large number of tasks. So when we talk to people about this, they all get it. So many people we talk to have had the experience of leaving the hospital, they're on drugs, they get a plastic bag with a bunch of pieces of paper in them. Oftentimes that paper has a bunch of written notes on it, and they get home and they look at each other and they say, so what did that nurse tell us to do? And that's one of the reasons why we are creating the health path. So if you take a typical scenario, let's take an ACL surgery scenario. What we create are templates, and these templates lay out everything that the patient needs to do before the surgery and after the surgery. So the templates are created by us, but then a hospital can come in and take our template and modify it and save it as their own template. And we will also have a service that allows hospitals to share templates with each other. So the adherence coach comes in, names the health path, and picks the template. All the things necessary for this particular ACL health path are populated by our service. So you have events like appointments and the day of the surgery. You have education activities, like we need you to watch this video before the surgery so you know what's going to happen to you. And then we have tasks, and the tasks are things that the patient has to do. The items in red are the items that need to be configured by the adherence coach. So they know immediately what they have to do to get this health path ready for this particular patient. One of the things they need to do is they need to modify a task about the antibiotic that the patient needs to take. So they have the type of task is medication. They name it, take an antibiotic, and they say the start time, 8 a.m. in the morning, and the frequency, how often do they need to take this. Now, this system is all very good for the patient. It helps them a lot. But one of the great strengths of this system is that the adherence coach in the hospital has a dashboard. And that dashboard lists all the active health paths and gives each one of them a status, red, yellow, green. So an adherence coach looking in the hospital can at a glance see the screen, see that everything is green, no worries. Now right here where you say number of failures until caution, that is configurable by the adherence coach to say if this patient misses this task, does not say they completed it once, turn the status to yellow. If the number of failures until intervention, they set that at 3. So if there's patient misses this 3 times, the health path will turn red, and at that point it is time for the adherence coach to intervene with that particular patient. We want them to give them the ability to intervene early, because an early intervention means that patient doesn't end up in the emergency room, and they don't end up having a readmission and the associated cost with that. So then the patient picks the drug that they need to take, see a picture of it there, and they put the prescription in there as written by the physician. So now, what does it look like from the patient side of things? So before the patient leaves the hospital, the adherence coach sits down with them and gets them registered with the service. And in many cases, hospitals, and this is the case with Providence, for some of their patients, they're going to give them a tablet computer to take home with them. So in case they don't have it, the tablet computer is hooked up to the cell phone network. So when they come home, they start up the tablet, plug it in, if they want to keep it plugged in, put in their PIN number, which will most likely be the last 4 digits of the phone number. Now, I have this, the prototype if you want to see it afterwards. I just didn't have any way to hook it up to the display here. So the first thing they see is for this particular day, they have 3 things that they need to do. First one is to take the amoxicillin, then there's an exercise and enter the level of pain that they're feeling. Now the instructions for the particular drug are there, and a picture of the one they're supposed to take. Then they also have all of the instructions or all the information about that particular drug, all the side effects, all the drug interactions that they have. And then 20 minutes before they have to actually do a task, they get this pop-up. And this pop-up is telling them, in 13 minutes, you need to do this. And at this point, the patient has the option to say, I have a question about this particular drug. Maybe this drug is causing them some difficulty in some way. So they can send a message to the adherence coach and say, you know, this is really giving me a lot of problems. Can I get a different type of antibiotic? Or they can just say, I have completed this. Once they say I've completed it, the adherence coach, the system that the adherence coach uses knows that they completed it, and there's a complete history of everything that the patient has done if the patient wants to look at it. There's also a complete history that the adherence coach can look at when they want to. So the other type of thing is a task about doing an exercise. And the tab up on the right there has video. So in case the patient needs to see a video about how to do an exercise, that's there. This could also be a task that says, I need to change a dressing. Here's a video on how to change a dressing. Anything that the hospital wants them to have instructions on. Now, we want to have a support network for these patients, so we have 3 groups of people who are going to support the patient once they leave the hospital. The first group is the care team. And the care team is the adherence coach, any physicians, any family caregivers that are actually caregivers with the patient are all listed in here, and they can have messages sent to them. The eventual experience will be similar to, if you're familiar with Facebook or LinkedIn, it will be similar to the kind of rolling messages that come in Facebook on the wall or inside of LinkedIn. So the patients are posting messages to a particular person, that person's replying, and everybody can see them who has access to the care team. We also have the friends and family. And the friends and family are only the people that the patient has decided to add. These are people that care about the patient and they want to know what's going on with this particular issue, in this case a knee surgery, it could be a heart surgery. And they can share messages back and forth in the same way. And the final group is a social support network. What this is this is the group of people who have been prescribed by a doctor the same type of health path. So you might have, and this would not be just within Providence, this would be across the entire country. So you would have a group of people who are experiencing the exact same thing that you're experiencing. So nobody in here nobody in this support network would not understand what you're going through, because they are going through the exact same thing. A very important thing that we feel that will make people be able to answer questions from other people who are going through the same thing that they're going through. And then they go back to the daily view that they have. There's also a journal, a daily medical journal that they can enter anything in that they want to enter into it. So if you want to see the real thing, come up afterwards and I'll show you the tablet. So the second product we have is called Doctor Discovery. So 25 million, and this was in 2004, 25 million consumers made a physician selection during that year. With the Affordable Care Act, that number is going to be much, much bigger. And what the situation is today, every hospital system in the country has a Find a Doctor option on their website. You get very few options during that Find a Doctor, and you end up with an alphabetized list of doctors. If you go to look at primary care physicians at any of the major hospitals in the Seattle area, you're going to get a list alphabetized of possibly 600 physicians. And how you're supposed to decide which of those 600 in alphabetical order is the one that you need to pick that's best for you is hard for anybody to do. So there's a thing called the Patient Practitioner Orientation Scale. It was designed for third-year medical students to give them an idea how patient-centered their thinking is. We utilize that, and that has been utilized in several studies, and these studies were all shown that the patient had a better experience, they had a higher level of trust, and that they had a higher level of follow-through with what their physician told them to do when they were matched based on the Patient Practitioner Orientation Scale. So what we do is doctors and patients fill out our profile. It's very brief, just about 25 questions. And then they get a list of the doctors. It is the same list they would have gotten before. It's just prioritized and personalized to them the way they view medicine. And this system is up and running today, and we have it in beta with a few organizations. So the third product we have is Medanext Analytics. This is when we take all of the information that we gather from Medasync and Doctor Discovery. We aggregate it all, following the rules of aggregation so that nothing can be, no personal identifiable information can be extracted from it. And we take this data and we give it back to the hospital in the form of reports that they can query any way they want to query. And then if the hospital decides that they want to get information outside of their own organization, they want to see what the national information looks like, they can go ahead and pay more and then get the national information that is aggregated from hospitals throughout our entire service. So from a differentiation standpoint, our content is probably the most important thing. We are creating templates for many major medical conditions and surgical procedures. And we're having these reviewed by doctors, experts in the particular area. So we'll find cardiologists to review the health paths for cardiologists. And we're creating applications that will run on cell phones, run on tablets, and will be basic web pages as well. So people can access it however it works best for them to access it. We're also taking a particular emphasis on making sure that this works for elderly, because Medicare patients are a lot of the patient population, so we want to make sure, I tell our developers over and over again that you have to make this work for a 65 to 70-year-old who's never used a computer before. So we're trying really hard to make sure all these applications are very simple to use. Now, one of the things that has been very interesting for us when we go and talk to hospitals is the concept of bundling. A lot of the large manufacturers, they asked us not to say who these are, but they're large manufacturers in the Seattle area, and they make things that fly. And they have come to these hospitals and say, look, we have a lot of operations for total knee replacements. We have a lot of operations for hernias is one of the ones they have a lot of as well. And we want a bundle that says, these are all the things that the hospital is going to do for this patient before they arrive at the hospital, while they're there, and after they leave. What the hospitals really like is health path also defines what the patient is responsible for. So as the patient goes through their health path, if they don't do the things that are defined for them in the health path, then the hospital doesn't necessarily have to pay the bundle price because there was a two-way agreement about this particular bundle. So our revenue model is a subscription model, yearly subscription. It's $600 per provider per year. This is a very reasonable price if you ever looked at the pricing for EMR systems. A lot of the EMR systems are $600 per provider per month. We're $600 per year per provider. And our setup is, there's no setup fee. It's a very easy thing for a hospital to do because they don't have any capital expenditures on their part. They don't need to have a data center. All they need to do is sign up for the service and begin using it. We will make the site that they access and that their patients access branded to their hospital. So when we do Providence, the patients are not going to know that they're not on a Providence website. We'll have a little thing in the lower right-hand corner that says powered by Medanext. Other than that, the patient has no idea they left the Medanext site, the Providence site, and they're off on our service. We're also going to work with a lot of the EMR vendors to integrate this information because, sure as you can understand, the information that you can put in tasks like check your blood pressure, what's your blood sugar level, all those type of tasks, that information would be best if it flowed back into the EMR system so that it becomes a permanent part of their record. So we'll be integrating with EMR systems to make sure that that flow happens. Initially, we'll be standalone from them. So as I said, Providence is our first customer. We're working with them to pilot it probably within about 6 months. We're going to be in a full pilot with them. We'll have a beta before that. And we're working with a lot of other clinics in the area, a lot of other organizations. Q Alliance, we met with them recently. And we have a partnership with Verizon for the tablets. So they're going to make it possible for us to strip everything off of the tablets other than what is necessary for that patient. That will allow us to apply for what is called DME, durable medical equipment. And if we can get the certification of durable medical equipment, then Medicare will accept that and the hospital can bill for it. So the financials. This number looks like it might be a little large for that number of people to deal with, but in reality, that number of 9 represents 9 hospitals, which could be all in a single organization. So Providence has 35 hospitals in the West Coast, so that could all be Providence hospitals. So it's not that difficult. If there was 9 separate customers from separate organizations that 16 people had to deal with, that would be a little bit difficult. We don't anticipate that. So our management team, I've been in the software business for about 20 years. It's my 3rd startup. We have a great team of people. 2 of them are here today, Megan and Teresa. Some great developers. A lot of experience across the whole team. And our board of advisors has been extremely helpful in finding people the right people to talk to and also guiding us in our decision-making process. David Jaffe, some of you may know him, former CEO of Harborview, currently CEO at Swedish. Rhoda Carlson, board member at Seattle Children's Hospital for 14 years. Pat Hagen, and Chris Samoji, a very well-known entrepreneur in this area in healthcare. And Tom, I think everybody knows Tom, so he's been very helpful in advising us. And that is what Medanext is creating. We are very excited to be talking with you about it, and I'd love to answer any questions that you have. Did I get that done and right on time? Perfect. Thank you.